Hello folks, Alfie here at Ventic Pain Relief Clinic with a clinical tip and trick. And this one today is basically working the subscapularis muscle. The subscapularis muscle is a clinically significant muscle in that if you're treating it, it's actually better in terms of releasing the shoulder than the pectoralis major or minor if you're working on them. So basically, if the person's coming in with a medial rotated shoulder, with a bit more of a protrusion anteriorly of the shoulder, working on the subscapularis muscle can actually help release that better, in my opinion, than the pectoralis minor or major, or working on the chest fascia, the pectoral fascia. Many of you guys have probably tried working on the pectoral muscles, and that it takes forever for it to release. You might get minimal results in terms of trying to get that shoulder to move. What I found is that this is somewhat of a shortcut to get that area to release. So this is Skelly right here. You can see I've taped Skelly up, and you can see that this is kind of like a review in terms of like where the subscapularis muscle runs. So it runs from the subscapular fossa to the lesser tubercle here of the humerus. And what it does is basically it immediately rotates the shoulder. It also stabilizes the shoulder along with the rotatorcuff muscles, and it also helps with abduction. It does a bit of that. So in regards to potential symptoms that may be alleviated, we're looking at patients that may have kyphotic postures, as I mentioned before, with medial rotated shoulders, with forward protrusion of the shoulder. So in other words, if they're lying on their back, you'll notice that their shoulder, their anterior shoulder, seems to be pointing towards the ceiling more so. They may have radiating symptoms down the arm, such as numbness and tingling, and that could be due to tight pectoralis minor muscles. In some cases, they might complain of tightness or discomfort in the posterior cervical muscles, the posterior cervical area. They might say to you, you know, my neck feels fairly tight, you know, it feels very difficult when I move my head. In some cases also, they might complain of pain in the wrist or discomfort in the wrist. And the reason why they're feeling this is that the subscapularis muscle can refer into the wrist. They might say that, you know, somebody's told them that they might have carpal tunnel or maybe potentially like tendinitis in the wrist, when in fact it's probably coming from the shoulder. In regards to clinical presentation, so the most obvious ones that complain of local shoulder pain will come to you and say, well, I've got like this pain in my shoulder, or discomfort in the shoulder. Usually, and I'm going to say about 99% of the time, they'll say to you that I'm having issues raising my arm. Whenever I do shoulder exercises, I find that it's either painful or very uncomfortable when I do this, or they might find that it's weak raising their arm up over their head. They could be in extreme medial rotation with forward protrusion of the shoulder, as mentioned before. You'll also note on visual inspection that the lateral superior posterior aspect of the scapula does not touch the table. So if they're lying on their back, you can place your hand between the table and the shoulder blade, and you'll note that it comfortably sits there. As also mentioned, they might have problems with external rotation of the shoulder. It's more affected on the affected side. There's also more tone upon palpation of the subscapularis relative to the unaffected shoulder. So when you're poking there, you'll note that maybe one's more developed than the other. They may also have tight fascia of the pectorals, along with tight pectoral muscles. While supine also, you're going to note that when you're trying to push the shoulder down, when you're pressing on the coracoid process, there's a lot of resistance. So you'll have difficulty trying to press that shoulder down towards the table as a clinical presentation. In regards to general technique, so this patient, although like here Skelly is standing, this patient will be basically supine. I'm just going to place my notes here. And what you're going to do is you're first going to tell them that this is not going to be the most comfortable experience in regards to getting treatment into the armpit. It's not very comfortable when somebody sticks their thumb in the armpit anyways. So your top hand, the hand that's closest to the head, so if Skelly's lying supine, it would be my left hand. if I'm working on the right side here, the right shoulder. So I'm going to place my hand back here on the posterior cervical area, and the reason why I'm doing this is that I'm actually feeling to see if the muscle relaxes in the posterior cervical region, and it usually does, like particularly when you're working on the subscapularis muscle. So you're going to place your hand here. Your other hand, your treating hand, is basically going to be pinching the subscapularis muscle on the lateral side. But before that, you're going to position the patient's arm so that it's internally rotated, where their palm is actually against their stomach. So it's basically just being held here passively. And the reason why you're doing that is so that the muscle's shortened and you're able to get in there better than, say, if it was taut. Okay, so now that they're in that position, with your left hand or right hand, depending on what side you're working on, is behind the person's neck, you're going to grasp the subscapularis muscle on the lateral side with your thumb on the anterior surface and your other fingers on the posterior aspect of the scapula, and you're basically going to pinch around the lateral aspect of the subscapularis muscle. And what you're doing is you're trying to find spots that are very, very tight. Once you find that spot, you're going to press down on it slowly and hold it until that muscle, until that part of the muscle relaxes. You don't ever want to go halfway in terms of waiting for the muscle to relax. In other words, just because it's not relaxing after 30 seconds, you don't want to just give up on it. It might take a minute to a couple of minutes for some of these points to relax. So once that relaxes, you're going to go over and try to find another spot on the subscapularis. You're going to do the same thing, have your hand palpating like the posterior cervical area. You're going to hold it until that area relaxes. Eventually, what you want to do is you want to, let me move the scale here forward so you can see better. You might be able to see that there. You notice that there's a black piece of tape right in the center of the subscapularis muscle there. Now the reason why I put that black piece of tape there is to indicate the central aspect, the center part of the subscapularis muscle. And you're going to attempt to try to get in there. So you're going to try to get into the central area, and this is going to be the most painful part of the treatment, just trying to get into that center spot. And you'll find that this is going to be the mother of all trigger points, mother of all tightness in regards to the subscapularis muscle. Make sure you warn the patient again. You're going to hold it there. The person might get referral pain down the arm. You're going to wait till that muscle relaxes. When it does, you will see huge changes in terms of the way that the shoulder area feels. So in between each spot that you're on, what you're going to attempt to do is you're going to assess and reassess. So the first thing you're going to check is you're going to check the neck to see how much softer it's become. You should note that it will soften up. The next thing you're going to do is you're going to check to see how far the shoulder can go down towards the table. So you're going to press on the coracoid process and see if there's much give. You're going to note that there's going to be significant changes as you progress through this treatment. You should be able to push down that shoulder a lot easier into the table. Next, you're going to get the patient to elevate their shoulder through abduction and flexion. And just like pushing on the anterior aspect of the shoulder, you're going to notice significant changes as the treatment progresses. As the subscapularis muscle relaxes, they're going to note that there's less discomfort going through elevation. Also note that just because I've mentioned that there's 3 spots generally, like you're trying to find 3 spots around the subscapularis, it could be between 3, 5, maybe there's more depending on how chronic the person's shoulder issue is. So take your time with it. This is not one of those quick treatments. This is something that might take 15, maybe 20 minutes to get that muscle to relax. So if you're just going halfway about it, you're going to find that the changes aren't as significant. If you do it correctly, you'll find that the person will come out saying, wow, my neck feels a lot better, I can move it better, I can move my arm through the range a lot better, there's less discomfort, less pain, and they might even say that their wrist feels a lot better also. So this is my clinical tip and trick today. It's on subscapularis, and as I said, this is like 10 times better than actually working on the pectoral muscles in terms of finding the significant changes. Also, the other thing I have to mention is that you're going to find that after doing this treatment that the muscles around the surrounding area will relax. You're not going to find that so much with pectoralis minor or pectoralis major working on that. You'll find it more so with working on subscapularis. You'll find that the deltoid relaxes. You'll find that the pecs relax with it also. So take note of that. If you've got questions, you can message me on Messenger on Facebook. You can also email me at admin@ventepainrelief.ca or call the clinic at 416-644-8894. I'm hoping this tip will help you along the way if you do get somebody coming in with that clinical presentation that I mentioned. Next week, we're going to talk about subclavius and releasing it and basically releasing the scalenes through subclavius. I find that sometimes when we work on the scalenes, it does not relax as well as we'd like it to. So we've got to look at it from a different angle. I found working on subclavius actually helps to relax the scalenes muscles. So that's next week. Have yourself a great day. This is Alfie again. Take care.